A Georgia high school is closing its doors today and tomorrow after reporting a cluster of COVID-19 cases. The outbreak at North Paulding High School was confirmed after this photo, you may recall, of a crowded hallway in the school where students do not seem to be appearing to be wearing masks. This photo went viral last week. But the incident actually hasn't stopped more than 20 other school districts in the state from starting in-person instruction this morning. So Mark Strassman is tracking the COVID-19 threat to students and staffers.
Just days after this photo of North Paulding High School was posted online, officials confirmed that in-person classes are now suspended. In a letter to parents over the weekend, the principal says, "We know there were 6 students and 3 staff members who were in school for at least some time last week who have since reported to us that they have tested positive for COVID-19.
They kind of just sent us into school and used us as guinea pigs.
Sophomore Hannah Waters, who was briefly suspended last week for posting the photo, says the 9 cases are very concerning.
Because even then, we don't know how many people those 9 people came in contact with.
Of the 21 school districts reopening today, 8 will be in person full time, many of them located in the South.
We know that children can get infected. They are not immune to getting infected in the first place.
Dr. Audrey Odom-John specializes in pediatric infectious diseases at Children's Hospital of Philadelphia. And according to the American Academy of Pediatrics, over 338,000 children have tested positive for COVID-19 since the onset of the pandemic. More than 97,000 of those were during the last 2 weeks of July. A new report from the CDC found that COVID-related hospitalizations for those under 18 remain relatively low. Hispanic and Black children were hospitalized at much higher rates than white children.
There is certainly some concern that those children have underlying health conditions that put them at higher risk for getting severe illness when they do get infected.
The school will be closed today and tomorrow for a deep clean. What happens from Wednesday on is unclear. A neighbor of Paulding County, Cherokee County, has had 250 students potentially be exposed to the virus. They're going to have to quarantine for 14 days, Anne Marie. It's a rough start to the school year and to in-class learning.
All right, Mark Strassman, thank you so much. So let us dig into this. Let us talk about strategies for effective school reopening. We want to bring in Joseph Allen. You are an assistant professor of exposure assessment science at Harvard University. Very specific, and I like that. That's what we need. Joseph, there's a briefing released by the Harvard Global Health Institute that talks about 2 different policies as potential reopening scenarios. I know as a parent why the situation that I have found myself in for my kids' school is that they are offering both 5 days a week in class and virtual. And they've essentially said, it's up to you, parents, whatever you're comfortable with. Other friends of mine, their kids are not going in at all, or they've independently created their own pods for sort of private schooling that they're doing on their own. I feel like a lot of this has just been thrown in the parents' laps, and we're not public health experts. So you are here to help us. Can we talk about the 2 different policies or 2 different possible scenarios? Like, what exactly are they that the Harvard Global Health Institute was talking about?
Sure. So thanks for having me on. I'm a parent too, so I fully understand the anxiety here. And to be honest, it's every option is out on the table. Everyone home, everyone at school, in some hybrid mix, and it's really quite confusing out there. And let me just talk about what we talk about in this report about what has to happen before we can get kids back, regardless of what plan it is you're thinking about. It's the when and the what. And on the when, you have to have community spread under control. And in that report that I worked on with the Harvard Global Health Institute and others at Harvard, we show that the number of cases in Georgia right now are too high for kids to be back in school. It is totally predictable that you would have these cases in Georgia because the community spread is high. On the what to do, you have to deploy these healthy building control strategies. There again, they failed to put in these strategies. You saw the picture of no mask wearing. They didn't put in higher ventilation or filtration rates. In fact, when I look at their plan, I don't see a mention of that. And even their response to this is 2 days closed with a deep cleaning. That's not the way to solve the problem, is cleaning all surfaces and walls and ceilings and things. That's really missing the big picture. If you're not looking at the when to open and you open too fast, and you're not looking at the what to do, the healthy building strategies, then you're going to have cases. It's really that simple.
Right. I think that's great to remind people that it begins with, well, what's happening in your location? I think sometimes people get really frustrated and they just want a yes or no answer. Can I have a family reunion in a park, or can I have a family reunion at my house? Yes or no? And it's just not that simple. It depends on where you are to begin with. So can our schools open with in-person in-person classes? Well, it depends on what's happening in your community first. But then the second level, if you determine that is going to happen, that is going to take place, that kids can go into the schools because the incidents are manageable, then what? Then what do you look at?
Yeah, so let me point everyone to a resource. That's a really good question. My program, Harvard Healthy Buildings Program, has a report out, Schools for Health. It's at schools.forhealth.org, where we have all of the metrics, so it's not so confusing on when to open, what to do. We have a resource, 20 questions every parent should ask before kids go back to school. We built a little calculator, a tool to help you figure this out. So hopefully that's a good resource. But on what you should look for, yeah. I had an op-ed in the Washington Post 2 weeks ago that uses the acronym School SMART. So we want to stay home when kids are sick, stay home when sick, teachers, administrators too, but that doesn't stop asymptomatic transmission. We know this. Mask up. We must have universal mask wearing in schools. A air cleaner in every single classroom. These provide several air changes per hour of clean air if it has a HEPA filter. R, refresh that indoor air. Bring in more outdoor air to help dilute indoor contaminants. It's not just about surface cleaning here. And T is temporary classrooms. Can we get kids outside? Can we use tents? Can we be really creative and reimagine what a classroom is like? And if we do all these things, we can eliminate or reduce the risk from airborne transmission. So again, it's what's happening in your community, but also then what's happening in your school. And we have that 60-page report outlines many risk reduction strategies. I think most people are familiar with hand washing, mask wearing, distancing where we can, group distancing in pods to separate kids so that if a case happens in a classroom, it doesn't spread through the entire school. But fewer people are familiar with those healthy building strategies I'm talking about. It's really quite simple. You control the source through a mask, and anything that's in the air you want to dilute with greater outdoor air ventilation, or capture in a filter, like using a portable air cleaner with a HEPA filter. If we do all of those things, we can significantly reduce risk.
Would you like to see whether it's citywide government or state governments or the federal government be more active in giving districts guidelines? You know, I mentioned that where I live, depending on whether, students go to a public school system or if they're in a Catholic school system like my kid, or they've got some sort of charter school, they're all doing different things. And there isn't really sort of a citywide mandate.
Yeah, I mean, you're really going to, you pushed a button, and it's a good one because we have grossly failed at the national level. Everything is ad hoc. Everything is state by state. There's mass confusion. There's no way my team at the Harvard Healthy Buildings Program should have been the ones to produce some kind of report on risk reduction strategies for schools. We did it because we didn't see anybody mobilizing in this regard. And so we have failed grossly from day one in January to get the conditions in place and the procedures and policies in place to control this epidemic. Then, when schools closed in March, the very first thing we should have done on that same day was to say, how are we going to prioritize getting kids back to school in September? It shouldn't come as a surprise to anybody that we're in August and kids would be going back to school. And yet we haven't done anything at a national level to coordinate plans, policies, or prioritize getting kids back. We haven't opened up resources. Meanwhile, we funded trillions of dollars in stimulus for other aspects of the economy. We've reopened bars and casinos ahead of prioritizing schools. Now districts and schools are scrambling without the resources or the guidance on how to do this right. And we're having these kind of conversations where we're pulling different reports and metrics. It's a massive challenge. It is a gross failing on the part of our national governments from day one. And schools is just a continuation of that, where they have totally failed, other than announcing these proclamations. Oh, reopen schools. Well, without guidance, without resources, that is not leadership. And we haven't seen leadership at all on this pandemic just from day one.
Do you think that we as parents and teachers, school officials, have to sort of shift our way of thinking about this pandemic? Instead of thinking, when can we get back to normal? We need to sort of think about, how do we coexist with this virus? Because it's not going away anytime soon.
Yeah, that's really sharp. I mean, if you looked at any of the epidemiological models going back to March and the ones today, it shows we're dealing with this constant up and down of repeated, let's call them waves or mini waves, whatever you want to call them. We see the cases hitting in different places at different times. We're going to have to live with this for the foreseeable future until therapeutics come out, or eventually the vaccine will be the end game. And that's not coming anytime in the next month. It's not going to be the saving grace anytime soon. So we're going to have to learn to live with this. For anybody thinking, I just want to get back to January 2020. Yeah, me too. But you know what? That is gone. It is past. We have to be looking at January 2021 and realizing we're going to have to live with this. Otherwise, we'll be in this period of lockdown. And we think about risk to students and teachers in the school. We also need a broader conversation of risk and why it's so important to get kids back to school and prioritize this. There are massive consequences to keeping kids out of school. Higher risk for abuse, exploitation, and violence, virtual dropouts. We're not even sure where some kids are. And I don't mean some kids like 10 or 20. Thousands of kids, tens of thousands of kids didn't check in the spring at all. Kids rely on schools for food, for socialization, and certainly the learning is not the same remotely. So this has dire consequences. There will be headlines constantly for the next couple months saying some schools somewhere had cases, and that's important to have those headlines. But what's missing from the conversation will be the things we learn months and years later about the consequences and the costs of all of these missing kids and the costs of school closures. These are creating long-term public health consequences. We can do better, and we actually have to, and it's not actually too late to do it. We just have to make it a national priority.
Joseph Allen, thank you so much. I encourage people to, look for the briefing released by the Harvard Global Health Institute. It's really the information that parents really need to make an educated decision about their children and whether they're returning to school full-time or part-time or whatever it may be. Really appreciate the time talking to you.
Thanks for having me on. I really appreciate this.